Welcome to This Explainer. Today, we're diving straight into a situation that strikes fear into the heart of pretty much every parent or caregiver at some point. Your child spikes a sudden high fever, and there are absolutely zero other symptoms. None. It triggers instant alarm bells, right? But as we're about to see, the medical reality behind a symptomless fever is actually fascinating. And understanding it, well, it's going to completely change how you respond the next time it happens.
Picture this. You pick up your kiddo and they feel, well, like a little furnace. You grab the thermometer, wait for the beep, and it blinks back at you 102.2 degrees Fahrenheit. Instantly, you start looking for clues. But there's no cough, no runny nose, no tummy ache, and no rash. There is literally nothing but the fever. That profound uncertainty can feel incredibly scary. But the honest truth is, in the vast majority of cases, a fever without other symptoms is not nearly as dangerous as it feels in that moment of panic.
Okay, first things first, we need a major mindset shift here. We have to understand what exactly we're looking at. A fever is actually a symptom. It is not a disease in and of itself. Think of it like a biological fire alarm. It simply means the body's immune system is active, awake, and responding to something. Once you realize that a fever is just a sign of the body doing its job, the whole mystery becomes a lot less terrifying. Your goal isn't to be terrified of the alarm itself, your goal is to figure out what triggered it.
So, what is that mysterious something the body is actively responding to? Well, it almost always falls into one of two clear buckets: non-infectious causes or infectious causes. Knowing how to tell the difference between these two tracks is the ultimate secret to handling a symptomless fever with confidence. Let's break them down.
Section 1. Suspect number 1. Overheating.
You know, a surprisingly simple non-infectious culprit for young children is just being too hot. Babies and toddlers produce heat super quickly, but their tiny bodies are actually pretty terrible at regulating that temperature compared to us adults. We often completely underestimate how much heat small children retain. So if a fever appears totally out of nowhere, you need to run through this basic overheating checklist. Are they wearing too many layers? Is the room overly warm? Or do they have heavy blankets on? Have they been in direct sunlight, sitting in a hot car seat, or just running around like crazy? Sometimes, the cure for a mysterious fever is literally just taking off a sweater and cooling down the room.
Section 2. Suspect number 2. Infections. Now, if you've ruled out overheating and the environment is fine, the fever is most likely caused by an infection. And this brings us to a major medical fork in the road. We have to distinguish between two major types of infections. On one side, we have viral illnesses. These are incredibly common, and the body usually just clears them up naturally without any special treatment at all. On the other side, we have bacterial infections. These are the ones that might actually require targeted antibiotics. This distinction is a huge deal, because most fevers in children are viral, meaning the body is already fully equipped to handle them on its own. Because most fevers are viral, and the body handles them naturally, we really need to rethink our job description as caregivers. Your primary job is not to aggressively fight the fever and force the temperature down to normal at all costs. Honestly, that's a really common mistake. Instead, your actual job is to support the child's body while it does the heavy lifting. So, how do we support them? Well, renowned pediatric guidelines, like the principles championed by Dr. Komarovsky, point to 4 essentials. Step 1, fluids. Fever increases fluid loss, and dehydration just makes everything worse. So offer frequent, small sips of water, milk, or electrolyte drinks. Step 2, cool, fresh air. A hot, stuffy room makes a fever so much harder to tolerate, so keep the air quality fresh and cool. Step 3, do not force food. Look, it is completely normal for their appetite to drop during an illness. Hydration matters way more in the first few days. And step 4, which is probably the most vital, closely watch the child's overall behavior.
Which brings us to the ultimate golden rule in pediatrics. Treat the child, not the thermometer. Not every fever requires medication. Let me repeat that. Medication is not mandatory just because the number on the screen is high. You really should only use fever reducers, like acetaminophen or ibuprofen, if the child is truly miserable, in pain, refusing to drink, or just can't rest. If they have a fever but they're happily playing on the floor, you generally don't need to medicate them at all.
Let's put this into perspective. Imagine 2 scenarios. A high number, say 103 degrees, in a child who is alert, drinking fluids, and playing with you is actually much less concerning than a much lower fever, say 100 degrees, in a child who looks pale, weak, and lethargic. The number matters, sure, but the child's behavior matters significantly more. Section 3. The red flags.
Now, while most fevers are totally harmless, there are absolutely specific red flags you can never, ever ignore. You need to stop observing at home and get a medical evaluation immediately if your child shows any of these severe signs. If they are unusually pale or weak, if they are difficult to wake up, or, very importantly, if they are breathing abnormally. You also need to call a doctor right away if they are entirely refusing fluids, if the fever actually gets worse after day 3, if it persists completely beyond day 5, or if scary new symptoms suddenly pop up. Breaking that 3 to 5 day rule is a clear, undeniable signal that a doctor needs to investigate.
And speaking of investigating, we have to mention urinary tract infections, or UTIs. In older kids and adults, a UTI is pretty obvious, right? It hurts. But in infants, they often present with absolutely no pain or complaints whatsoever, just an unexplained fever. That is exactly why an unexplained fever in a very young child often requires a doctor to run a urinalysis, just to rule this sneaky hidden infection out.
Section 4. The most misunderstood illness.
All right, let's talk about something that notoriously confuses and terrifies parents of children between 9 months and 2 years old. Roseola. It is the classic symptomless fever. It begins dramatically, usually with a really high temp, and lasts for about 3 to 5 days. Parents are incredibly stressed during this window because, well, they have no idea what's wrong. Then, right around day 4, the fever abruptly drops and completely disappears, just as a widespread pink rash breaks out all over the child's body.
Now, when that rash appears, families understandably panic all over again. They assume, oh no, my kid is having a dangerous allergic reaction to the ibuprofen I've been giving them. But actually, that rash usually means good news. It signals that the viral illness is finally ending. Roseola is extremely common, and just understanding this specific quirky timeline prevents a massive amount of unnecessary panic and completely unneeded medications.
Section 5. Febrile seizures.
Okay, we need to address something that is incredibly frightening to witness: a febrile seizure. Seeing a seizure during a fever is a terrifying experience for any caregiver. And yes, while any seizure absolutely requires immediate medical attention to make sure everything is okay, it is vital to know that most febrile seizures are not dangerous in the long term. They happen because a young developing brain is reacting to a very rapid shift in body temperature. They look alarming, absolutely, but medical experts assure us that they usually do not cause long-term brain damage.
As we wrap up this explainer, I want to leave you with a really crucial piece of medical wisdom. If you take your child into the clinic and a doctor looks at you and honestly says, "I don't yet know what this is," remember that this doesn't make them a bad doctor. In fact, it often makes them a very good, careful one.
Because the truth is, medicine isn't magic, and it doesn't always provide instant answers. Symptoms naturally evolve. Sometimes the safest and most accurate approach a doctor can take is just careful observation until the missing symptoms finally appear to clear up the picture. Most of the time, the missing symptoms simply haven't shown up yet, and once they do, the path forward becomes crystal clear.
A symptomless fever feels super mysterious, but as we've learned today, mystery does not automatically mean danger. So the next time that thermometer spikes but the child seems okay, take a deep breath, stay calm, keep them comfortable, keep them hydrated, and ask yourself this final essential question. Are you merely treating a glowing number on a piece of plastic, or are you actually treating the child sitting right in front of you?